Well, first, thank you very much for the opportunity to come to speak with you all this morning. Joan and I had a few exchanges via email, and I had mentioned that I'd hoped that this could be just more of a coffee and conversation as opposed to some kind of a formal dog and pony show. I guess before I get started and end up going into some monologue about the Portage Health Foundation and who we are and what we are, are there any questions or anything in particular that folks would like to touch on this morning, that I can make sure that we are responsive to the areas of curiosity that you all might have? Anyone? This is going to be a really easy group then.
I have a question.
Sure, Robert.
Yeah. Are you, to what extent are you still connected with the Portage Hospital system?
Okay.
Yeah.
I can touch on that. Miriam?
I have a question. My question is, are communities of faith allowed to request grants from you?
What can you repeat that?
Are faith communities, specific faith communities, allowed to request grants from you?
Sure. Okay. Anything else that anybody has that they want to make sure we touch on? Okay, I'll get kind of started here. I think, as everybody knows, and maybe Robert, this will answer your question right off the gate. Back in 2011, 12, and leading up to December 1st of 2013, forthcoming changes within the healthcare system, and the expectation of the Affordable Care Act changed a lot of dynamics within the healthcare arena. And the result for Portage Hospital at that time was looking for an upstream affiliate that they could partner with that would ideally help stabilize some of the financial positioning of the hospital systems. And that's not unique to Portage or any of the other local hospitals. Keweenaw, and such have all gone through similar mergers and acquisitions. But the result of that joint venture in 2013 was that the proceeds from the sale of the hospital, I was able to take with our board of directors, reestablish the Portage Health Foundation, which was a supporting organization to the hospital, as an independent nonprofit community charitable foundation, just like any other community foundation. Most often, foundations like the Portage Health Foundation are referred to as a conversion foundation, and in most cases will remain as a private foundation as opposed to a public charitable foundation. And in the very beginning, actually before the joint venture was inked, I had seen some of the original documentation that would result in the reincorporation of the Portage Health Foundation. And in fact, it was being reincorporated as a private health foundation. And, one of the things that, and I think goes back to some of the concepts that Wayne had talked about in my intro, one of the things that was, very apparent to me is that a community of this size, with all of a sudden an asset of this size in the form of a foundation, really had a lot of opportunity to do some unique things as a community foundation, as opposed to a private foundation where we had just reinvest, portions thereof each year back into the community. So we had petitioned, I had actually at that time petitioned Jim Bogan to consider reincorporating the intended foundation as a community foundation, and we did that. Robert, to your question, the Portage Health Foundation still retains a 20% equity ownership in the hospital, no different than any other investment. And and that's been an interesting relationship, because the way that the joint venture is structured is there's 50-50 voting, but there's an 80-20% ownership, and most of the management responsibilities have been delegated within the joint venture contract to LifePoint Hospital Systems. So our interest, although we still have a presence and we still have some participation within the governing board, it is somewhat minimized because of that ownership interest, and we're working through that. But that's where it is we still have a 20% equity ownership, more of an investment at this point than anything that we're looking at. You know, in 2013, kind of to start, I can be very honest, as a somebody new to the foundations, although I come, you know, from a fairly good background within the nonprofit community. My experience within the foundation world was limited. And you know, as we set forth looking at how we were going to not only invest and protect this newfound community asset, a lot of that was really predicated on how are we going to best reinvest earnings from that portfolio back into meaningful projects and initiatives within the community. And I can tell you in the beginning, it was really interesting. I think in the first, we had set out about 120-day reincorporation plan. It was a unique situation because even though we were part of the hospital and existed before, as we converted, we were completely new. We were a new startup. Everything from building out office space and accounting systems and all of the administrative functions that you can imagine need to be in place, along with setting a course for you know, the direction that the foundation would take to look at meaningful investment that we're going to address the, you know, the deeper issues within our community and the things that cause risks to both individual and population health. And originally we had set out with 5 unique pillars, addressing education and emerging healthcare leadership, you know, addressing issues of community health and access. But you know, I can tell you that we've matured. Our ideas have matured. Out of the initial, in that first several months, you know, 6 months of operation, we had about 100 and I think we were up to about 117 different community interviews with stakeholders and individuals and groups across the region and the state to kind of shape, you know, somewhat shape the direction that we were going. And that resulted in those 5 pillars, and it resulted in some of the early investment that you can see through some of the granting. But as we became more involved, as we became more in tune, and certainly more engaged with different partners from across our community, you know, our initiatives have evolved as well. And you know, we're working on some updates right now to our website. But those 5 pillars have changed to our strategic initiatives. Our long-term objectives right now really fall under 6 primary areas with an overarching area of, you know, improving overall physical, mental, emotional, and spiritual health for all of our citizens, and creating a shared vision of what health equity means for this community. But in those 6 areas, in no particular order, we have been working really diligently to increase access to education. We recently launched a new initiative that was actually supposed to start a couple of years ago, but was somewhat derailed from moving forward because of the flood. And there again, there was some blessings within that, because that experience that we had as an organization helping our citizens respond to the flood. I'm not sure if everybody's aware, but we ended up functioning as the general contractor and coordinating services for about 421 homes that summer, restoring water, heat, home mitigation, you know, you name it. And a lot of the homes that were more significantly damaged were in some communities that were a little bit, you know, had more of a rate of impoverished, lower income families. So we were able to see and get to know some of those families firsthand and see some of the challenges that they're facing, probably a little bit more intimately than, and I don't wish that experience again on anybody. But I think when you start reframing some of these things and you find those blessings, there was a lot of opportunity for us to learn. And certainly it just created a greater resolve for us as a foundation to further our initiative.
I lost Mark.
You muted yourself, Kevin. Or somehow you got muted.
Am I back? No.
Yes.
So the second area is we just launched a Bridges Out of Poverty initiative a couple of weeks ago, and we're excited about that. The third initiative that we've been working on, and many of you may be aware of, is a food initiative. And to the extent that we have hired Dr. Michelle Siegman, who is a licensed family practice physician, is also a functional medicine certified physician, and she has been hired as our director of community health. And we've actually done we've done one food nutrition study. We're currently working on a second study with Dr. Angie Carter from Michigan Tech, and Dr. Michelle is working on a third food nutrition study that's focusing right now on some of our at-risk families, and as part of our CSA, our community supported agricultural share program that we're working with a number of human service agencies and about 24 families from throughout the 4 counties. The fourth area is just a general sense of trying to build safer communities. And I could talk about a number of different initiatives that we're doing, from everything from our drug enforcement support of the Upset West law enforcement team, to some integration with our community, our substance use and addiction service providers, and Dial Help as crisis. We're working right now with the Blue Cross Blue Shield Foundation to bring some community education and awareness sessions focusing on human trafficking, sexual assault, and sexual coercion. A lot of people, and I'm not sure if it's in your social circle, to be sitting around having, Sunday morning coffee talking about human trafficking. A lot of people, when I bring it up, say, well, we don't have those problems here in this community, and that's absolutely false. We have seen a number of cases recently, and I can share as a general statement, where we've had families that have been prostituting their children for access to drugs. And, it's just simply unacceptable. So we're going to be working to have a conversation and creating some awareness to, what is underpinning some of these health risk issues, and certainly trying to create some awareness to help protect some of those children and families that might be victimized right now. So there's a number of different things that we're doing as part of just, trying to build safer communities, healthier communities. Another area is providing access to support healthy living. If you have followed some of what we're doing, there's a reason that we're investing in some of our trail systems and our parks. I'll use the community of Chassel as a good example. They've done a very good job organizing their parks and recreation. We've been able to support some of the work that they've done with the fitness trail, the new some financial support of their new playground, and some of the developments at the waterfront park in Chassel, as well as the kayak launch. And part of that is when people in our community want to make the conscious choice to be physically active, physically fit. We want to try to make sure that the built environment is supporting them in a way that is going to help that decision to be healthy and active. And part of that is just creating the access points for that. So we've invested a fair amount of money over the last number of years in recreation, outdoor recreation and wellness, in our trail development, in our infrastructure, repairs to existing facilities. And that's going to continue as we move forward. The other piece is supporting medical research and innovation. Some of you may have heard me talk about the partnership that we have with Michigan Tech. The first partnership financially was a $2.5 million commitment over 5 years, which was matched 2-to-1 by Michigan Tech at the time, really focusing on undergraduate scholarship, new scholarships for high school students entering health career fields, graduate and postdoctorate research projects and fellowship programs. So that essentially almost $7 million that was invested was largely invested in advancing the education opportunities. And it goes hand in hand with that first goal of increasing access to education, in particular healthcare education. We've expanded our scholarship offerings over the last number of years. We started with, I say meager, which is I think it has to be taken in relative terms, about $50,000 a year in annual scholarships. So right now we have about $250,000 a year budgeted for annual scholarships for all our area high school students, and a number of local institutions of learning, as well as students that are going abroad. So we've done a lot to encourage and to support financially the educational aspirations of our young people and our citizens over the last number of years. And that's going to continue to grow. And we have some bigger ideas on what we'd like to do with our educational support. And then, finally, as I mentioned, that's all intended to improve, physical, mental, emotional, and spiritual well-being of our citizens.
Okay, mute. I don't want to mute. Stop video.
So any questions up to this point? I think Joan had asked me, in the email, how do we go about this? What's our process for strategic planning and community input? We have a board of directors of about 12 members that are selected from the community. Many of them were, I guess, an inherited board that has gone through some attrition and replacement. But the way that we structured our board, we also have a fairly large number of non-governing board members that serve on our different committees. They have a vote on the committees, and the committees make recommendations to our board. So it's a way of getting a broader community input without having to have such a large board that the board becomes immobilized from making, responsive decision making. We've done a lot of other things to measure effectiveness. One example is I've contracted outward to a group called the TCC group that they specialize, one of their specialties is assessing foundations core capacity to transition or transfer action to meeting mission-based outcomes. We use them as a way of gauging how effective our organization is doing and the culture that we're developing here. And I'm very proud to say that we've actually scored really quite well on their external assessment. And then just, we have a lot of people that come in here throughout the days, weeks, with ideas and whatnot that we work with, and all of which is taken into some consideration. The big thing that we use is the health risk needs assessment that we partner with the Western UP Health Department on conducting every couple of years. It's an important tool for us and for our community members to look at some of those core health risk factors and how are their strategies or grant proposals and whatnot coming in. How are those focusing on some of those areas of risk that exist, and how do we measure some success? So, again, as we continue to mature and grow as an organization, you're going to see more outcome-based measurements and some reporting that we're working on right now to look at, the effectiveness. But I think one of the things I would add to that is that the changes that we're trying to influence in our community are not changes that are going to happen overnight. You don't miraculously reduce childhood obesity from 38%, overnight. You don't change those type of habits that are contributing to health risk factors with one-off programming. So you're going to see some longer term investments in our various initiatives, like our poverty initiative, like our food initiative. One of the areas that I'm really proud of right now is the work that we're doing with our school systems on youth trauma and resiliency, and the work that the schools are doing to address that within their populations and our support of that. But you're going to see a longer term investment in some of our strategies as multi-year commitments and not just one-offs. And that's one of the changes that I think we function a little bit differently as opposed to some of my funder colleagues, is they'll have a spring and a fall granting cycle. It's different every time. We're not like that. We're looking at, challenging. I guess your organizing question when I was in the beginning was, how is this money going to influence systemic change in our community, and how do we make meaningful investment that's going to allow it to happen and do that? So what questions? I mean, that's a little bit about the foundation, and I could get into specifics, and I could go on and on about the work that our teams are doing and our community, more importantly, the successes of our community partners. But is there anything in particular? And before I open that up, I'll go back to Miriam's piece. We do grant to, our policy is to grant to faith-based organizations for non-sectarian purposes. So if it's for a program that doesn't, isn't promoting a particular religious or belief philosophy, and it's more broadly a community engaged initiative, regardless of belief system or whatnot, we will consider those applications, but we will not fund applications from faith-based organizations that are, promoting a particular belief or philosophy or another.
Kevin, this is Horace Schmidt. I was wondering, do people have a form that you require them to fill out in order to get in that grant application into your organization, or you just come in and talk to you, or what?
We do it a couple different ways, Mr. Schmidt. Some of what we have, part of that organizational growth and maturity over the last few years has resulted in more and more of our budget being allocated going into the year with either specific programs that we know our community partners are working on, or some of the programming that we're doing. And I'm going to touch on that for a second, so bear with me. Most foundations are what's considered non-operating foundations. They just review a grant, write the check. And one of the challenges that we've had as an organization is that we are bound to serve the 4 counties. So our partners that exist within the 4 counties, in some cases, provide some restrictions or certainly some challenges as we try to meet community need. We just don't have partners that can do some of the things that we know need to get done. Or we have partners that simply, they do what they do it really well, and they don't want to end up with mission creep to start looking at adding on. So the relevance of that statement to your question, Mr. Schmidt, is that in some cases, a lot of the monies that we are putting out right now, more and more of it is being allocated going into the new year as part of an overarching strategy and investment in some of these key areas and in key partners. For example, we do quite a bit of work with Dial Help. We've developed a really strong partnership with them on many wraparound and service to our family and children. And we provide some seed money or some underwriting of some of those programs that we know need to happen. And without that support would not be happening. The other part of that is we still do responsive granting. We will do specific calls for proposal. We will have earmarked certain program initiatives that will do calls for proposal. And then we also have a small, relatively small amount that's left as unsolicited applications for funding. And to put it in perspective, this year our operating budget was about $3.4 million, and about 360,000 of that was left for unsolicited applications coming in. And right now we're actually kind of nudging the envelope a little bit. And most of that money has been awarded, where I think we're down to about $100,000 of that has yet to be awarded. And we have a couple very interesting letters of inquiry that have come into our office. The other part of your question, Mr. Schmidt, is that on our website, you will find, underneath the opportunities, you can find areas of making a request, and you will see the different granting applications. There's also a FAQ section that talks quite a bit about our granting and some of the things we're doing. And again, some of that information is going to be updated and brought to some current language, but most of the information is still there.
That's great. I just wanted to segue into something else. As you're aware, the federal government has allocated money called the American Rescue Plan, and there are other ones that are in the offing. And I was wondering if this is an area that your foundation would be interested in, since our local governments, which includes county and municipalities, I think even some authorities, if there would be a synergy that could be developed to maybe carry out more of a program than the amount of money that the federal government will allocate. But it just seems like such a golden opportunity for really stretching the resources we get the federal government into perhaps something that where your foundation would be able to also step in at this and augment in some areas. Have you thought of any of that?
I'm actually glad that you bring that up. Absolutely. We have had some short conversations with some of our local officials on how some of that ARPA money might be used. And more importantly, having some conversation about some of the direction that might be able to utilize some of those ARPA funds in a much more meaningful and long-term position, as opposed to maybe reimbursing for some expenses that have already been incurred. I've already reached out to our legislators' offices in the state to talk with them a little bit, set up some meetings with them to talk about some of the utilization of the ARPA funds coming through the state. We have talked about some of the monies that might flow through our schools. And certainly there's some other projects that we're working on as a larger, from a larger community lens. One of the things that, and I'll briefly touch on this, I won't get into too many details because I don't have my proof of concept here with me for this morning. But one of the things that we are looking at the foundation, and one of the things that I've interviewed for, and to your point again, Mr. Smith, back in 2013, I mentioned about how can this asset be developed that would have a much more impactful role within this community, not just from a social services, human services, charitable standpoint, but how does the work that we do help drive our economy? How does it influence our civic and economic vitality? And one of the things that we're starting to explore right now, my board has endorsed and given me authority to move forward with, is we're starting to look at the creation of a community-wide wellness campus that would help provide for integration of care services amongst many of our nonprofits that are serving our community, along with a lot of the other community type activities that folks are looking for in this community, not only benefiting, our existing population, but one of the things that we get asked all the time is, when are you going to build a YMCA, or what are you going to do to, help address young professional recruitment and retention of our young families and whatnot. So we're going to start that, and we're going to start having some public education and public forums, input gathering sessions on what a facility or campus like that might look like and entail, and to look at whether or not we can do it. I know from the research I've done already that there's some fairly significant challenges with the population center of this size for a facility like that. But I think that there's some modeling that we've been able to identify a blend of public, private, for-profit, nonprofit that might make it actually a possible option for a community like ours and really benefit. And to your point with your question, Mr. Smith, certainly right now there's an opportunity with some of the ARPA monies that are focused on wellness and wellness systems improvements within communities to focus on wellness that we might be able to take advantage of and help with that initiative.
I was wondering if there would be a possibility of having community forums, because I know there are some groups that are starting to form, or people are talking about it, and it seems like it's a great opportunity to have a conversation about where the funds should go, versus what our government officials may think they need to spend it on. So I was wondering if that would be something that, we could come to you and talk about and see if we can set up community listening, talking sessions, that type of thing.
I can tell you from the work that we're doing here, I've been working with a firm out of Lansing right now, just kind of frankly working through my own biases on this project, because I think it's a great idea and I don't want that bias to influence whether or not it is or not. I think the data and the numbers and the community input is going to help direct that. So I know from our lens, looking at this initiative, not only with the campus, but in that process, it's going to directly and indirectly give the foundation more updated information on the direction that we take. That will result in some community listening sessions that I'm going to have facilitated externally, again, to eliminate any internal biases for or against things, and specifically to the ARPA funds. As a community member, I would hope that we would be able to have some input, into how our local systems of government are looking at reinvesting some of those monies. Certainly from my professional position, I would be more than interested in having a conversation about if there was ways that we could leverage those for community good in a way that might be outside of that normal scope of municipal management. We've developed and I believe have enjoyed and embraced a strong working relationship with our municipal leadership, and are trying to look at the investments that we make as a foundation as ways of contributing back to our local economy, whether through job creation or just the investment of the millions of dollars that we put back in over the last we're at 7 years now. We've invested millions and millions of dollars back into our local economy, while at the same time being able to position the portfolio growth to be able to start looking at some larger projects like this and have the leverage and some of the social capital needed to execute these projects. So it's a chess game. And if you look at it like that, it's a matter of positioning, and we want to make sure that we're not only being mindful stewards of this resource, but also being very attentive and intentional about the direction that we're taking to meet the needs of our community, both today as well as what we can anticipate in the coming years. And a big part of that's going to need some more community input.
I have another question, but I want to give other people an opportunity to ask them as well before I go ahead.
Okay. I see a finger raised by Miriam.
Are you, I know that the Community Arts Center in Hancock, they do a lot of good granting things with the Michigan Council for Arts and Cultural Affairs. And I'm wondering if you're, I'm really excited about the possibility of a community center here, and I would think that partnering with them.
I wouldn't disagree. You know, I'm gonna touch on this in maybe a couple different ways, Miriam, and maybe some of it's, maybe I'm anticipating where you might go with some of that, and maybe some of it will be just additional information. We recognize that in a broader sense, when I first met with the Attorney General's office and they looked at, you know, the investment has to be made back into the healthcare of our community, most health foundations will take a very literal view on that, and they'll focus on healthcare access or something like that. And when we met with the Attorney General's office at the time that we were inking the joint venture, you know, my question on this is, how do you define health? How do you define a healthy community? Because I can tell you that, as an example, we can demonstrate through the research that's been done through our health risk needs assessment that the higher level of educational achievement of an individual or a family unit, the less health risk factors that exist for that family. When you look at the higher levels of, and some of this just seems simple, right? But when you look at the higher levels of earning income potential, the risk factors go down. When we look at communities of, if you think of life expectancy and longevity, and there's some certain studies that you can look at, and I don't have these exact data quoted to memory, so don't quote this and cite this, as Kevin said, but you know, some of the studies that we've seen will demonstrate as much as an 8, 10, 11-year difference in life expectancy, going from maybe North Hancock city limits to Osceola Township limits. You will see a significant life expectancy. I'll give another example. You know, there was a fairly significant life expectancy difference between the two different ends of Duluth, Minnesota. You know, because one was more industrial history and a lot of the old buildings, as opposed to the neighborhoods and the homes up along the North Shore leading out on the north end of Duluth. And there was a substantial difference. I think it was like an 11-year difference in life expectancy. So when you start looking at that and you have to ask why, you start considering that. So back to my point, when we talked with the Attorney General's office about what does it mean to invest in the health of our community or in a health access or whatnot, you know, they gave us a little bit of free rein with that, with some exceptions. So I will say our Giving Tuesday event that many of you may be aware of, and I'm looking at some names that I know many have donated to, you know, we get questions, well, why don't you have this organization included in that Giving Tuesday? And part of it is because the corpus of our investment coming out of that hospital precludes us from investing in some of those other issues that are not so clearly defined as a health initiative. The Humane Society, for example. And I could argue that my pets do more for my health and mental health than anything. But it's a little bit of a reach in some of the things that we would fund. So there's some areas like that that we just have to be a little bit more, I guess, careful of. And that's why you might not see us invest in some areas. That's one of the reasons that we haven't invested in some of the Art Council grants in the past, But that's not to say that if there wasn't a particular program, let's say, for example, there was an art program that was specifically focused on a veteran community, and it was largely focusing on some area of mental and behavioral health or some kind of art therapy or whatnot like that. You know, that might be something that certainly we would have a conversation with them on and look at how we might partner that. And we also are looking at some of those community partners that exist in our community that may want to be or should be assessed for inclusion in that community wellness campus in a way that would be meaningful for our mission delivery.
This is Jan Dalko speaking. I want to give just a bit of history here. In 1967, I think it was, Pavo Nurmi was built in 1968, and it had a pool. I think it was in 70 or 71 when Andrea Hauge was hired to be the director of Pavo Nurmi, essentially to develop it for not only for the students and faculty, but for the community as a sort of YMYWCA. You might talk to Ken Seaton about this. He's a good example. As president of what was then the D&N, he insisted that his employees not use the elevator, that they use the stairway, even if they worked on the 7th floor. And that's one of the reasons why at the age of 92, Ken is walking 5 miles in the canal run. But I don't know if you've contacted different business managers about insisting that their employees use health activities on the job. But that's one thing. Another thing that I wanted to mention is that at that time, people from the community were coming in and using the pool. There was a swimming for tots, exercise program for other people, people swimming laps. While I worked there from 1968 to 1984, I swam every noon that I could, laps. But people at noontime would come in and play basketball in the gym. And even though it was 18 times around the gym for a mile, people were running around the gym. So I'm wondering how much local facilities, the high schools, Painesdale with the pool, Michigan Tech now with the pool, and with gymnasiums are being used as sort of community centers. I know there is at least one person who's watching in this Zoom right now who swims at Michigan Tech, and she's 93 years old. So I think there are existing facilities that might be used better or more, assuming that their administrations would allow it and encourage it, as well as working with different businesses to make sure that their employees are doing healthy things. That's my comment.
Jan, I think there's a number of areas that are spot on with that. You know, we do have some resources that exist or have existed in this community. One of the challenges that we've incurred as we've talked to some of them is that those organizations are not necessarily, their intention or their mission is not to serve as a community recreation resource like a YMCA or whatnot. So we run into some issues with, you know, obviously the funding and whether there's return on investment for utilization of their facilities. I'll use tech as an example for non-student related activities in absence of, you know, they do it in absence of a larger community type of a program. And there is, I would tell you that, you know, we have no interest in redundantly developing a program that could be done elsewhere. We are looking at how can we blend, you know, essentially a mission-built, purpose-built facility that not only would exact the agencies that would partner in their mission achievement, certainly the foundations, but would be better equipped to meet some of those health risk needs that exist within our community and organize it in a way and have somebody champion in a way that we would be able to steward that, you know, programs and resources and the financial support that's needed to make it scalable. And that's one of the challenges, and I'm going to talk real briefly on that. You know, one of the things that we see in so many cases is that the needs of a small rural community like this, you know, a micropolitan, if you will, community, don't change and are not any different than any other larger population center. But what changes is the geography of achieving and sustaining or serving those areas of need and their resources. And I can use UP Kids as an example with their family foster supports and adoptive programs. You might have a case manager downstate in Southeast Michigan that has 20 families and they're serving 5, 6, 10 blocks, where here Mark Lambert and his staff are driving, you know, 200-mile radiuses to serve that same caseload. So the funding coming in to support the program is the same, yet the ability or the requirements to exact that service for that population is amplified so much that it's no longer cost effective. So what I'm getting at is you have a need and you have limited resources. The challenge is always how do we effectively scale those to make it a sustainable model for our community, and sustainability is a big piece. So I appreciate your comments, and I certainly appreciate talking, the idea of talking with Mr. Seaton, because I was not aware that he was an advocate for the Pablo Nurmi Center to be more publicly focused. So I would like to have some insight with him. Thank you for that.
Another comment. I was the director of the library there for 16 years, and I understand that the educational institutions' activities are primarily for the students, the faculty, and the administration. But there are certain aspects that can be open to the public. My
Yes.
library, for example, at that time was open to the public,
Oh.
and it still is. But the problems with scheduling at Pablo Nurmi, and that the same thing at Tech, is you have to schedule around the academic program.
Yeah.
And so there are only certain blocks of time that are available. But my one of the things I am concerned about is drownings and swimmings and doing dumb things on the water. And it seems to me that every citizen in the state of Michigan should know how to swim. And I know of some institutions where the students are required, in order to graduate, to be able to swim not the length, but the width of a pool, so that they know how to handle themselves if they overturn when they're fishing or when they get into a riptide or whatever it is. So
Sure.
you understand where I'm going there.
Yeah, I do.
So I want to, Jan, I really appreciate that. I was born in South America, Suriname, Kevin, and by 4th grade, every 4th grader in the country was required to take a water safety course. And you got certified and you got a diploma for it. I think when we talk about how to engage this community and create a really a value proposition to them, and how our organizations can support them and their families and improve their quality of life, this is something that I think is an opportunity to pursue. And figuring out which partners should be in place. Is it the school systems, the school districts? Is it MTU? Is it community-based foundation? But so through that interaction, that became a gateway to other activities. By the time I was in 4th grade, I also learned how to play chess to complete my cognitive and what I call critical thinking skill development. These are all gateways to engaging communities. And from there, you can talk about movement, you can talk about healthy eating, all the things that you support. So I don't know how we can, the Keweenaw Unitarian Universalist Fellowship members can support you, but these are the kinds of things that, as a community member, I'm personally interested in figuring out how we can help out. So hopefully this conversation can lead to some of those initiatives being
I mean, I think so much of it, and you'll hear me all the time talk about, come on up and have a cup of coffee and conversation. I think part of it is just that, and the willingness of this group to, or the interest in inviting me to come speak with you this morning. I think it's just a great start of, achievement. It starts with understanding, and that starts with awareness, and creating awareness to the work that's being done or the need that exists to be done is a big first step in that. So I appreciate not only your comments, but this opportunity to speak with you guys. Other questions? Joan, is there anything else that you wanted me to touch on that would be beneficial this morning, or?
Kevin, or it's Schmidt again. I've got a question about, the rift that occurred in the community during the pandemic, and especially with the health department. And I know there's a group called Keweenaw Faith United, which worked with, started out from an anti-Semitic issue, and then we see that the two issues that came out of the pandemic and the underlying issue of racism in the community. I was wondering if there's anything that if we're talking about the health of the community, this certainly is should be a high priority. Do you have any plans or thoughts on this area?
I think, one of the things that we've really tried to do, Mr. Schmidt, is to keep the foundation's efforts focused on the outcomes that are needed for a diverse community, and to maintain the integrity of those strategic initiatives. And frankly, without not avoiding, but without getting caught into a lot of the political narrative one way or another. I think when we just stay focused on the work that we're doing and the members of our community that we're serving in our strategic initiatives, that those outcomes speak about the intent and the role that the foundation can play. And and that's maybe in and of itself is a political answer, but you start getting, if we start getting too embroiled in that, and even where we start, we've seen some of the politics leach into our board conversations. It's like that's not mission focused decision making. Let's focus on the human needs that exist, and let's allocate our resources to achieve that. And I think, from the foundation's lens, during the pandemic in particular, we worked hard to really sort through a lot of the white noise and a lot of the emotion, to keep it to fact-based decision-making, outcome-based decision-making. We did an awful lot to coordinate our community partners to convene at least weekly to talk about the challenges that they were facing. For example, Little Brothers or Senior Meals or the Dial Help organizations of shelter homes, and really tried to make sure that we were coming together as a community to share that burden, share those ideas, keep the conversation solution focused, and not get caught into a lot of the other rhetoric. And that's not minimizing what is happening in our community across all levels. We're just trying to be intentful on what our mission is and to keep focused on that.
Kevin, you may have just answered the question, but does the foundation have any interest in getting involved in the change of the parking structure in Houghton for redevelopment?
Of what structure? No. And it was interesting because there was, we do participate in a group of just community leaders and representatives that came up, and there was a letter of support that ended up in the paper, and there was a meeting that I don't recall being at, and I'm not contesting that project or supporting that project. Again, we would want to look at whether or not we had a role in that from a mission delivered, a mission outcome. That's for other people to debate that, not really part of the foundation's approach right now.
That's what I thought, yeah.
So I think we have time for maybe one more question or comment, and want to be mindful of Kevin's time. I see Joan raising her hand.
Yeah. Thanks, Wayne. And thanks again, Kevin, for being here this morning. It's been really interesting to hear all the comments and what the foundation is doing. I am one that always likes to look at what else could be going on. And I'm wondering if there's any way, obviously people bring ideas to you, but like, it seems like there's so many communities across the country that we could really gain a variety of ideas on what they're doing. I'm wondering if there's any way that I guess formally that happens, or if it's just totally happenstance, what someone brings forward. Just to have, I don't know, do you have a way that you gather creative ideas of what other communities are doing that we might be able to bring to the Keweenaw?
The short answer is yes. We do engage in national conversations, conferences, attendees. We spend quite a bit of time focusing on the development of our board and staff members and making sure that they are supported to stay up on current issues. The approach that we've taken, I'm going to say this, I don't want it to sound from a position of arrogance or ego, but I'm very proud of the reputation that our foundation has earned in certainly our local, regional, and state community amongst funders. We're a little bit unique. And part of that is because we do spend so much time formally and informally with our community, listening and engaging. But at the same time, we've taken a very hands-on approach to the amount of work that we'll do as a foundation to do root cause analysis and dig deep on the issues before we start investing in. And that's been part of our maturity as an organization. And that's taking note. So for example, the Blue Cross Blue Shield Foundation wants to utilize our model of community education awareness on human trafficking as a way of bringing that system of awareness and engagement. And they're looking at funding that both for the rest of the Upper Peninsula and the rest of the state. And it's because of those relationships that we've developed both, nationally or statewide and to some extent nationally. But most importantly, I'm more concerned about what the people of this community think they need and what kind of separating the wants and the needs and then drilling into where those areas of, again, scale versus resource to make that happen. Because our focus is here, our focus is on home, and we want to make it a better home for everybody.
I just want to say thank you very much for keeping your focus, which is where it really belongs, and making sure that you stick to it. Thank you very much.
I appreciate that. Thank you.
Kevin, the Keweenaw Unitarian Universal Fellowship, thank you for your time and the work you do in our community. And, I'm sure we are excited about any opportunities we can individually and collectively support your efforts. Thanks for giving us part of your Sunday.
Thank you. Thank you for the invitation. I appreciate it.
I want to say